Hello? I
No,
think
we
this
can't hear you.
Good morning, distinguished guests, survivors, caregivers, healthcare professionals, and champions in the fight against cancer. My name is Princess Tinu Lawal, Chairman of the Nigerian Cancer Society, Lagos State, and the founder of the Atinuke Cancer Foundation. It is my utmost honor to welcome you all to the 16th sensitization webinar organized by Higher Cancer Initiative, themed Hope Rekindled. This is not just another webinar. Today is a celebration of life, resilience, and the unbreakable spirit of every cancer survivor who continues to shine brightly despite the challenges. This platform brings together survivors, medical experts, spiritual leaders, and policy advocates to share wisdom, encourage healing, and reignite the flame of hope for everyone walking through the journey of cancer. As someone who has walked that path and lived to testify, I deeply understand the emotional, spiritual, and physical toll of the diagnosis, the battle, and the journey after treatment. But what makes gatherings like this today so powerful is that we come together not as patients or professionals alone, but as champions united by one cause to keep hope alive. We have an impactful lineup of speakers this morning, luminaries from across the globe and Nigeria, who will pour into us insights on emotional well-being, spiritual grounding, navigating survivorship, and the power of community. As I moderate alongside my fellow moderator, that's Dr. Anato Ayuba Usman, I invite you all to be fully present. Let today stir something new in your heart, a renewed belief that cancer does not define you. Your courage does. Your courage does. Your scars do not mark defeat; they mark victory. Once again, I say welcome to everybody. Let's make this morning one of connection, compassion, and hope rekindled. Let's begin. As our discussants today, we have the Catholic Archbishop Ignatius Ayao Kalgama. We have Professor Kimlin Tam Ashing, Dr. Dennis Ejo, Dr. Aisha Mustafa. But I'll be making excuses for some of them. We're sorry, the Catholic Archbishop Ignatius Ayao Kalgama is mourning his late brother and may not be present here today. We have Professor Kimlin Tam Ashing, who has sent in our presentation. Because of time differences, she may also not be here today. So we have left here, we have Dr. Aisha Mustafa, who also made an excuse for not so sure our absence today, but she's also sending in our presentation. I'm not sure. Can you please confirm if Dr. Aisha is here? Dr. Aisha, here.
Yeah,
Okay.
thank you.
Thank you for being here. Thank you for coming. Thank you for making out the time. I understand you've been so busy since yesterday. I think I'll be seeing you later on today as well. In advance, I say nice to meet you. Then we have the special guest of honor. Our special guest of honor for this webinar is Honorable Kunle Olanrewaju Ibrahim, the SSA to the President on National Assembly Matters. He's also going to be present here. Is the Honorable here, please? Can somebody please confirm if Honorable is here? Dr. Taufik.
Yes,
Dr. Taufik, is the
yes.
Honorable around? Okay. You're welcome, Honorable Olanrewaju Kunle Ibrahim. It's nice to have you amongst us. And then, as the moderators of today's program and the facilitators is myself, my humble self, Princess Tinu Lawal, and then Dr. Anatu Ayuba Usman. So we say welcome to everybody. Thanks for joining us. This morning we will be, just 1 minute, please. Can we have the presentation of Professor Kimlin Tam Ashing, please? Dr. Taufik.
Okay, very
Dr.
shortly.
Taufik.
Very shortly, ma'am.
Okay, okay. Thank you, Dr. Taufik. So while Dr. Taufik is at that, let me just quickly go over the program of today. Dr. Taufik, please let me know when you're ready for me.
That's okay, ma'am.
Okay. Okay, today, Saturday, the 28th of June, 2025, 11 to 1 p.m. would be the duration for this webinar. And the activities starts with the arrival of all registrants, and we would have the welcome address, first of all, by Dr. Bilkis Usman Farouk. Please, do we have Dr. Bilkis Usman Farouk on ground? Dr. Taufik.
Yeah,
No, please,
I'm
madam.
present.
Of Dr. Taufik, Dr. Bilkis Usman Farouk.
Yeah, good morning, everyone.
Good morning,
On
Dr.
behalf of
Bilkis Usman
yeah,
Farouk. Thank you for joining us.
you're welcome. You've more or less welcomed us all to the seminar. So, on behalf of the organizing team, I warmly welcome you all to this 16th webinar presentation of the Career Cancer Health Initiative with the theme titled Rekindled Hope. So, more or less, you've introduced the topic and you've also welcomed us all. So, I welcome all the participants, the survivors, the medical practitioners, and all the stakeholders in cancer care as we go through this, I'm sure, interesting and inspiring webinar. We'll take home a lot. Thank you very much and welcome you all. Thank you.
Thank you to Dr. Usman Farouk, Dr. Bilkis Usman Farouk. Thank you so much for the welcome address. Next is the presentation of Professor Kimlin Tamashing. Can we have the presentation, please, Dr. Taufik?
Yes, can you see the slide? Can you see the presentation now?
I'm using my phone. I've had to put off my laptop now, so I think we can see it. We can see it. Can you please start the presentation now? The slides. If the presentation is on, we can't hear anything. Okay, in the absence of the presentation, I would like to remind everybody that the title of Professor Kimlin Tam Ashing is Anxiety Management and Physical Well-being. She's from the City of Hope Comprehensive Cancer Center in the United States of America. And so we shall be seeing a slides now, a presentation about on anxiety management and physical well-being. Can we have the presentation, please?
Seems we're having a little issue with sharing of the presentation. I've already asked that it can be sent to me so that I will do the sharing from my end. Let's see how that goes in the next 2 minutes.
Are you referring to me or Dr. Taufik?
You, ma, in response to your question, ma, so that I will see if I can share from my end. I've asked Dr. Taufik to probably send to me so I can share from my end.
Ask Dr. Taufik to do that because it's difficult for me
I've
to
already
do
done.
and
Yes, I've done
also
that.
yeah.
I just didn't want you to be waiting and be wondering what is happening.
No, it's fine. I'm okay. I'm fine. Let's allow
Okay.
Dr. the
Okay.
Good morning, everyone. Princess Tinu, thank you for holding on. This is wonderful. All
thank you.
protocols duly observed. It's Dr. Ayuba on the line. Sorry, my network is a little bit dragging, but I'll just to greet everybody. You're warmly welcome to this great fora where we're going to have so much discussions on cancer survivorship. All protocols duly observed. We welcome all our distinguished guests. Prince Tenu, thank you very much for this. Carry on. While we wait for this video, cancer survivorship is a very important aspect of care for cancer patients and survivors. The survivor, defined by the NCCN guidelines, is any individual who has a cancer diagnosis all the way to the continuum of care. And so this is why the management is important, it's pivotal for the family to be aware, for the healthcare workers, friends and family, and the whole community. So you're all welcome to this very important occasion. Friends, continue. I'm right behind you. I'm right by you. Thank you, Ma.
Thank you. Thank you very much. Thank you, Dr. Anatu, for the for co-moderating with me. Thank you so much for that addition. That was really very, that was a very important message you just passed. The cancer survivor, as we all know, is someone who's been impacted with cancer and is living with has gone through the treatment and is thriving on. These days, we don't call ourselves survivors any longer. We don't even say champions. We call ourselves thrivers. I'm going to start with telling you a little bit about myself when I was diagnosed as a cancer survivor. When I was diagnosed of cancer. But before then, I would like everyone to know that cancer is, I know I'm talking to the converts, but I'm sure there's some people amongst us here who are not doctors and who are not survivors and would really want to know a little bit about the journey and all that. Before I was diagnosed, cancer was a very big stigma in Nigeria. It was something that we don't just even discuss like that. I don't even think they were having webinars like we were having like this openly like this. If there were webinars, maybe amongst the doctors and all that, it wasn't so freely, discussed like this. It was so stigmatized that, it was believed that it was an attack from the village or some kind of curse placed on someone by the enemies or, just bad luck generally. At the time that I was diagnosed, that was in 2014, it was at a time when there was Ebola in Nigeria, and everybody was scampering around trying to ensure that they don't get caught with the Ebola. It was a very difficult time in Nigeria where everybody would wash their hands at every opportunity to do so. So you can imagine at that time when everybody had that fear in them, and then suddenly you just discover that you have something that is even as bad as that, you know, what was, spooky to everyone, So, but it was, I never had any, I can't remember having anyone around me who had cancer, not even in my family. So for me, it was quite a very difficult time. It was something that I do not wish on anyone, around me. Even now that we talk about it, it's something that we don't, I don't wish for anyone around me. So while I'm still at that, can I just check on Dr. Taufik? Dr. Taufik, any?
Yes, we can move on to the next presentation. The file is very, very heavy, and
Okay.
attempt to have it reduced is not too successful now. So we can go ahead while it's being sorted from the back end.
Okay, so you mean, okay, so we're not ready with the Archbishop's presentation. Sorry, Professor Kimlin's presentation.
Yes, we can have Dr. Aisha once she's ready, ma'am.
Okay.
Dr. Aisha.
So please, since you are here, let's not take too much of your time. I understand you're very busy today. So can we have Dr. Aisha Mustafa do our presentation now? You have the floor, Dr. Aisha.
Hello. Good morning again, everyone.
Good morning, Dr. Aisha.
Just to warn us beforehand that I'm going to go in between my networks because none of them is quite strong. And then I may have to put off my video so that I just try to improve the bandwidth. So I think if I will be sharing from my side, let's see how it goes. Requesting to bypass. Allow. When I show entire screen or particular window. Okay, so I'm just trying to share my screen. Please just let me know when you can see my screen.
Yes, we can see your screen.
Okay, thank you very much, everyone. I want to thank the organizers, the Cancer Health Initiative, for this very important webinar and for inviting me to give this very short talk about this topic, the emotional roller coaster, coping with diagnosis and treatment. Like the moderator have said, they have defined who a survivor or a champion or a thriver is. And we have also gotten insights from our very good friend and supporter here, a champion. We can actually see that, okay, sorry, I think this is the recording, so I'll just stop sharing since I'm giving a live presentation. Let me know if I stop sharing. Can you still see my screen?
Yes, no, we can't see your screen now. It's you. We're not seeing your screen.
So let me see if I can just reshare. I was looking for the presentation. So share screen, entire screen, and share. Okay. So I just want to be sure that this is the correct presentation now. That was the recording. Slideshow. Okay. So let me move to the next slide if that's possible. It's still not going. Let me see. Okay. So it's just about, oh God, it's still the same thing. It's just about who I am. You know, I'm a clinician. I love to do a lot of cancer surgeries, prevent surgeries, and also trained to operate here in Nigeria. I'm trained abroad as a gynecologist. Currently in the last bits of my fellowship, I do a bit of administrative work. I do a bit of medical politics. Very importantly, I do gynae oncology research, and I also advocate for prevention and treatment of gynae cancers on different platforms. So a step at a time, I do a bit of all of these things. I do community service provision to prevent and treat gynecologic cancers, not just cervix, in both rural and semi-urban areas. I'm also a trainer of nurses, healthcare workers, resident doctors, and myself. I have also been trained in numerous capacities by numerous organizations just to improve gynecologic cancer care in Nigeria. So this is just all the organizations that train me. But very importantly, the reason I'm giving this talk today is about survivorship and how I have gone through my own diagnosis and survivorship. So the topic is very apt. It is actually an emotional roller coaster indeed. And for me, it was a mixture of everything. I remember that day in January when my friend called me and said, "Where are you?" And I said I was at home, and the diagnosis was brought to me. It was a mixture of fear. I was really scared. I was anxious. I was in denial. I was angry at myself. I was sad. But above all, and because of my religious beliefs, I gave gratitude to Almighty Allah for everything, for being able to get this diagnosis early in. But then I kept thinking about health, my future, my family. Will my husband be able to finance my treatment? What's going to happen to my body? What if the treatment doesn't work? What if the disease progressed fast? What if it's aggressive? What if the so-called early stage 1A1 actually has one lymph node with micrometastasis? You know, I thought about everything because I saw women with this disease and I treated them. What was I going to have? Will surgery be enough? Will I have to have chemo radiation? You know, will I have to go through all of those tubes in me? If I have to have chemotherapy, what about that fatigue, the nausea, the hair loss? Oh God, my hair, what's going to happen to it? You know? So I kept thinking about all of those things, the pain, the paresthesias. I thought about everything my patients went through. And of course, the bodily change. The fear of the unknown was so enormous. The uncertainties were there. And honestly, the sheer exhaustion of getting a diagnosis was sincerely overwhelming. And even though I tried to put up a strong face, it was very difficult for me within. Very importantly, I had a very strong support system, to be very honest. I had colleagues at work, I had friends who, while I am trying to be strong, they were the ones shedding a tear. But all of this was since COVID, January of 2020. It was not a very good period to have a diagnosis. And I had all the support system I could get simply because I was one of them who was in the system. I was a medical doctor, and my colleagues were all out for me. My family was there. Initially, it was difficult. I didn't tell my kids until years later after completing my treatment. And I actually saw myself as somebody who was a privileged survivor. I use the word privileged because I was lucky to get a screen detected lesion, a very early diagnosis that was amenable to the least invasive treatments, you know. And ever since my two surgeries, I have not had any issues. Even though I have this anxiety when I'm doing test of cures, what are they going to find? Are they going to find some abnormal cells? You know, I have done the test of cures here many times and also in different countries, and it has remained negative. But there is always that sense of uncertainty that you continue to live with for the rest of your life. I remember when I recently had abnormal vaginal discharge and I started thinking, what is happening? So you just have this fear in you of something you would ultimately not take seriously. And then I had to tell my family at a point, my sisters, we are just four of us. I had to break the news to them. Unfortunately, my only brother died after that, but they were all there for me during that period. That phone call I made to them devastated them, but it made me feel better. I had other complications, and the very important one was the fact that I could not donate blood. Prior to my diagnosis, I was a regular blood donor. I'll go there every 4 to 5 months, donate blood. And then I walked up and they said, no, sorry, you can't donate blood because of your diagnosis. And I went to read about it. I was so angry with them, but I went to read about it and I realized that, yes, I could not donate blood until at least 1 year after after I had been declared of the disease. So I had to quit. And after 1 year, I have continued my regular blood donation. The last was 2 months ago. Sorry, 1 month ago in May. 7th May was my last blood donation. So I have continued this. So these are all the things that happens differently when there's a cancer diagnosis. You don't tend to be able to do all the things you were doing prior to that diagnosis. But then I went all out. I said it everywhere. During ward rounds, I mentioned it. I say it to everybody that we are going to destigmatize cervical cancer. There is a lot of stigma about it. I say I have been treated. I say I am fine. I say I have screen detected tumor. And for that reason, you should go for your screening. Don't be silly. You have to go for your screening because you may not know that you actually have microinvasion or very early disease. Mine was caught at the earliest possible stage, and that even took a second opinion in the UK to be able to detect the very tiny microinvasion in the tumor. How did I cope? First, I actually allowed myself to feel everything I was feeling. I justified my fears, I justified my anger, I justified all the uncertainties I was feeling, and I tried not to blame myself because initially I was saying, okay, Aisha, you should have gone for your smear as at when due. And then I thought about it. I said, this is not the time to blame yourself. This is the time to love yourself. So I allowed myself to continue to feel whatever it is I was feeling. I didn't allow anybody judge me. I remember somebody telling me, oh, don't be too hard on yourself. After all, haka Allah qaddara, meaning that's what God has destined for you. And these people don't understand what you're going through. You know, it's so easy to say haka Allah qaddara because it's not you. But I honestly think we should be more empathetic about what people feel at that very difficult period in their life. And very importantly, I sought support from family, from friends, and I was lucky to get that support. I educated myself. I read about the options. And I started to practice self-care. You know, self-care is not a luxury, honestly. With or without a cancer diagnosis, it is a necessity. And with a cancer diagnosis, it is even more necessity. So it doesn't have to be anything highfalutin, just some time off, just some pampering, some exercise, meditation. Like for me, I actually joined back my community group. I live in a community called Kabama. You know, I joined the Kabama family back here, and time after time we have hangouts. You know, we just rest, we relax. Every month we go out. So I honestly felt it really helped, and I think we should begin to practice self-care. And my talking about it is actually a coping strategy. You know, I don't want people whispering, I think Dr. Aisha had cancer. No, let me tell you myself. You don't have to whisper it. So talking about it for me was a coping strategy, and I kept talking about it. And then I remembered that I was a resilient person. I will look at myself in the mirror and say, Aisha, you know you're a strong woman. You're actually stronger than you think, and you can cope with this. Don't let it break you. So I keep reaffirming that to myself, even in the mirror. So these are the ways I coped, and I keep saying that I was privileged. Early diagnosis, I didn't have to go through chemotherapy or radiation. Surgery alone was curative for my disease. So I believe that as we continue to spread the word, we continue to say, get informed, get vaccinated, get screened. Let us remember that there are women or men too, children that will still get the diagnosis. Somebody will still get cancer. So I do hope that we will try to show more empathy to these people, understand their reactions. Whatever reaction they put up should be understandable to us as family, as friends, as healthcare providers. I do hope I've been able to make us realize that the impact is actually beyond finances. And even when you have all the money to treat yourself, you still need all the empathy and support, and your feelings should actually be justifiable by whoever is caring for you. I do hope I've been able to shed some light on the often unseen emotional side of the journey of a survivor. So I just want to call on all of us that we should continue to build a world where those survivors feel truly seen and supported. Thank you very much. I'll be happy to take any specific questions.
Thank you very much, Dr. Usman. Thank you so much. Yeah, thank you very much, Dr. Aisha Mustafa. Thank you very much for that presentation. And that was really educative, I'm sure, especially to those who have never been impacted by cancer. I know I understand exactly how you felt, and I can't say that I totally know everything, because your experience is really quite different from mine experience, and mine experience is different from yours. And so, every cancer survivor's story is so unique, very unique, and you can learn one or two things. So thank you for educating us, and then the information, and being so strong and being so open about it. I'm glad that you did your part. Thank you so much. So next we will be having Dr. Dennis Ejo come on board. She will also be discussing, or she'll be discussing, sorry, Dr. Dennis Ejo is the founder and the CEO of Commode Cancer Foundation and a member of the National Task Force Committee for Cervical Cancer, the NTFCCE. Yeah. So she will be talking about the emotional roller coaster, coping with diagnosis, and sorry, I hope I'm not mixing things up. Okay, I think Dr. Dennis will be talking about the new normal, embracing life after diagnosis. Am I right, Dr. Dennis? Are you there? Dr. Dennis, are you there?
Here, I am here. I'm just trying to work this out today. Hello, how are you?
Very well, thank you. You're welcome to the platform. You're welcome to the webinar. You have the floor right now. I just said your topic is the emotional roller coaster, coping with diagnosis and treatment. Sorry, that's Dr. Aisha. Sorry, yes, yours is a new normal, embracing life after diagnosis. Am I right?
That's, I think, correct.
Thank you, thank you. So
I just
you
want.
have the floor. You have the
Can
floor right now. Sorry?
Can you see my screen?
No, we can't. We are seeing you.
Okay, now what do we do here? Now share screen.
Yeah, you need to share the screen so we can all see it.
I am trying to share the screen and I don't know how to do this.
Oh, wow.
Oh, this is what I don't like with all this technology.
Dr. Taufik, is it possible for you to send it to Dr. Taufik?
It's not working today. I don't think the things are working. So hold on. I did open it now. I don't know what's happened.
Okay.
You need permission to share screen. Okay.
Okay.
So I'm waiting for somebody to give me permission then.
That should be the Dr. Taufik, please, can you give a permission to share a screen? In the absence of that, I think we can have you, can you keep talking while, yeah, I think Dr. Taufik is busy. No, we're seeing you very well. We're seeing you.
Okay. Share screen. Allow to share screen. I've clicked it.
Maybe if there's entire screen or some, I saw that.
Go to entire screen. Okay.
Yes.
Okay, now it's on.
Show your screen anyway. Is that it?
It's okay.
Yes.
Okay.
So now we see your screen.
So this is my screen. Can you see my screen?
Yes.
Yes, we can.
You see your screen.
All right. So let's go. Let me just keep going now. No need for start. Let's start. Let's go. You can see that, right?
Yeah, we can.
Okay. I'm being honest with you. I can't see it. So don't bother about it. I'm just going to just keep going. Yeah.
Go ahead and speak then.
Okay then. Hello everyone. My name is Denise Ejo, the CEO of Commode Cancer Foundation. I always have a smile on my face. Dr. Aisha, thank you very much. I have to catch up with you at some point.
We should.
Cancer stories are very unique. I already know okay, so when we know ourselves, we know ourselves. Nothing. We can't run away. Our stories are very interesting, and our experiences are varied based on whatever we go through. But I really, really appreciate this. So, sir, thank you very much for inviting us to come and talk about this. HCH, I am honored to be here, and especially a month like this. Every year we come to this month, I always take time out to have a lot of gratitude to God, because there's no reason why I should be alive. I'm not different from anybody else. But when you have an out topic to do, you've got to do it. So I really am celebrating with survivors, caregivers, and warriors, and everybody on this platform today. We appreciate you. Together, we are bringing you hope. We are bringing ourselves hope, and we will win this battle. I stand for my experience, and I'm going to use a lot of my experience to have this conversation, because I believe that sometimes when people see pictures, they have a bit more hope that okay, I have a chance, and I have a better chance at this. So we're going to go with that in mind. So where am I going? This is my story. When the diagnosis hit, like we all have a common statement: the shock, the emotional roller coaster, the physical, our identity gets disrupted. We get into an unknown, the fear of the unknown. Nobody knows tomorrow. For those of us who have families, we don't know what's going to happen to our children. We don't know what's going to happen to ourselves. We don't know. We don't know. A diagnosis may disrupt my life, but it does not end my story. Anybody here with cancer, that is my takeaway for you. A diagnosis can disrupt. It has disrupted. 9 years on, I'm here today only by the grace of God. I can't lie. Taufik knows that. And it's only because I've just had another brain surgery in the last 48 hours. 2 days, 3 days, Thursday. And is that because I am special? No, it is because God loves me enough to tell me that I have something to do. And that's what we're trying to achieve. Understanding that we all have a purpose and we have an assignment. If we get it right, we'll be good. So I am hoping that we will rekindle what this is all about. So this is where we got to. I had to learn how to redefine life after this diagnosis. And I think every single cancer patient that is alive has to learn it. You first have to learn about this body of yours that actually messed you up because it wasn't planned. Cancer is somebody else's sickness. If we want to be honest with ourselves, it's not ours. It's everybody else's sickness. It's just a word. All of a sudden, it became a reality. All of a sudden, it became yours. All of a sudden, everybody's looking at you. You are trying to hide. You're trying to live a life. You cannot try anymore. A diagnosis just changed who you became. I was a teacher. I was heading schools. I was living life. I was happy. I was all over the place. And everything changed. So is every cancer patient's story. Then we have to now work a new approach to how we're going to now change that, because it's either we sink or we swim. One person spoke to me, Professor Adewale spoke to me when I was diagnosed again about 5 weeks ago that tumors have started to grow again. I haven't finished the ones before a new set had started. And I said to him that I'm tired. And the one thing he said to me is, Denise, whatever you do in life, be tired, but don't give up. Every cancer patient on this platform today, that is what I took away from that conversation. Be tired, don't give up. So the people around you are the people that are going to help you not to give up. But if you say you're not going to be tired, it's a lie, because this journey is tiring. Even those that have got cleared, they still have the issue of going for that yearly check. That yearly check causes severe mental, emotional, psychological challenges. So we can't lie about it. But then I changed and I said, no, what am I going to do with this? God, what do you want me to do with this? And I decided that it was time for me to identify who I was. And I wanted to be a warrior, not a victim. And I think all of us do. So this is how we started. The first things I had to learn, my body. start to understand, start to listen to it, start to forgive it, start to heal it, start to be happy, start to do things positive, start to drive my things that are important to me, start to look for me. Then with time came living fully. And to some of you, you've met me, some of you meet me online. I use a walking stick. I can never forget when I had to use a walking stick 3 years ago. I actually told them I was no longer fighting. As I was done. Because I was in so much pain, I didn't know how to navigate anymore. And then I had to learn now to living fully. And I rechanged my mindset. My friend always tells me about this mindset. My mindset had to change so I could start to relive my life fully. And now, if I am asking for wheelchair access, I don't even feel ashamed again. But I have a lot of my friends who need it more than me, and then they will be sitting there telling me they're not using wheelchair. I'll be looking at them that you have mental problem. Because I had to learn that my identity became important. I now attend events. I didn't attend events for many, many years. I write my books, I go out, I go to IDP camp, I go to places that I would have been afraid to go to before, but I became a patient from a patient's perspective to a purpose. And that's what I like listening to when I'm on this type of platforms, because I like to hear other people that go through this. But this is who I am beyond all of this, beyond anything I say today. This is what my God is everything. Beyond anything anybody sees. Because no matter what, there's the fear of a recurrence for some people. There's a fear for people like us that are terminal, and it's just a matter of time. It's just there. Then you have the part of you're lonely, you're unhappy, you're pitiful. No, I refuse to be. You have a mental health challenge. Yes, we all do. Because you have too many things you're dealing with. So what? I am not my diagnosis. I am who I want to become. That's what I want us all to know. You, no matter who you are not your diagnosis. You are who you want to become. No matter what they tell me now, I look at this, the thing, I have now got, this is surgery number 7 to my brain this week. And I'm asking myself, how many more years have I got? And I started to calculate again that maybe I have some more options available. I don't know, but God does. And that's why this is all I need. And so how do we move forward? I learned how to heal with others. I've learned, and I want others to learn. You can't do this journey yourself. You can't, forget it. Share with other people, support groups. Let your voice be a doctor. Asha just said now, she tells her story herself. You know why we have to tell our story? Because other people will help us to tell us what is not the problem. If we tell it, you will own it, then we have an identity, then we're not crying. Caregivers are silent heroes. We really appreciate you. We're not going to sit here and say we don't. Whatever we are, whoever we are, we know that you have helped us. And you may not realize, but sometimes we go crying because we can see you crying, but we don't know how to help you to cry because we are trying to find us. And we know that if we're here, you will be all right. So please just bear with us, but that's who we are. And that's why our shared stories become our shared strengths. Because together we can, with you on one side championing our cause, with all the support groups working with us, and with ourselves, we will get there. So as I'm getting to the closings of these things, I start to look at the survivors. Survivors become advocates. We're all advocates, every single one of us. We are now creating our own impressions. We have life from a new lens of life. We see life differently. We can't see it because I can no longer chase things I used to chase before, Now, if you wake up in the morning and you can stand up from your bed, you are very grateful. If you can't stand up till the evening, you're very grateful. I'm taking steroids. I hate steroids. I hate steroids. I hate steroids. I hate steroids. I have to take it. But that is my reality. So what? I must create expressions. Everyone here, create expressions of how you are feeling and validate them. Don't throw them away. Validate them and use them to go forward. And that will help you. And also I'll leave forward. This is what everybody knows me with my Common Cancer Foundation, media. That's all I know, and I'm not going out of that area. I can't go and raise money for people that have cancer because I have cancer. I have the same bills everybody has to pay, so I'm not going there. But I can go and do things for individuals. I accept without defeating. I have redefined my own happiness. Please redefine your own happiness. Choose joy, hope, and purpose. Don't let anybody take you down. You cannot be broken. You can only become. No matter what is happening, you can become. You go around, you sit down, you look at all the things going on. I had to get my children involved. My youngest is graduating now. I saw this child when she was in JS1. Is it not God? It's not man. Man cannot have brought me this far. So I'm looking at everybody. I'm saying to everybody here, please don't let defeat. And so for us at Common Cancer Foundation, one of the greatest things we want to drive is partnerships. You can't do it alone. Partnerships help us. We are partnered with, we have to come back. I don't even understand. KCHI, we partnered. We are partnered somehow. I'm sure we are somewhere. But every story here counts. Every life matters. Every single cancer patient here, you are a champion. You are the best thing. You are a best reflection of who God wants you to be, and you will make very good choices. Just focus on what is important. You are not alone. Look for the help around you. Like I say, together we fight. Together we will win. Together we heal. I keep using that word together. It's in this cancer journey I did PhD. You can achieve anything. I'm trying to show you. I'm grateful. I've achieved more than I could have thought, considering I had to stop working before I turned 50. I retired. Before I returned 50, I have watched the child go through university. I have done 7 surgeries to my brain. I am disabled. I am what? It doesn't matter. Your journey is valid. Make sure nobody takes you down. You mustn't allow yourself to not be validated. Validate yourself. Anywhere in the world, become a volunteer. It's not about Common Cancer Foundation. Anywhere in the world, please be a volunteer. Start a support group. Share your story. Just become somebody new. Do things. I do things that I just come up with and ask God, what do you want me to do now? But I don't run around doing things that are not in my space because it's only things I understand. I stay in education. That's all I know. And I won't go out of education because that's all I know. If you know something, say that and let that be your gift. Just join the movement and let us do this together. I want to say a very big thank you. I am very privileged that I don't take opportunities like this for granted. It is about us, but it's also about the people that think that our voice matters. KCHI, I want to say thank you, Dr. Taufik. You're always there stressing me, but it's quite nice. It gives me a reason to know that, okay, then these things are still good. So thank you. And to everybody listening, thank you all very, 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 very much for this opportunity. Cancer champions, heroes, survivors, you're still number one. Thank you.
Thank you for the session. That was a very interesting one. So thank you. We appreciate your session. Moving on to the next session. I think we're back to Dr. Taufik, and we're back to getting the presentation on anxiety management and physical well-being. We actually all need to listen to this, and I'm sure it's going to be a very educative one. There are loads of things that goes on with a survivor or a patient while they're going through treatment, and part of it is managing anxiety and the physical well-being. Just as Dr. Dennis said the other time that she has to, mental health is very important, and she has to, so there are loads of things you cannot even imagine and you would never wish on yourself that happens with a survivor, that happens when you're going through cancer treatment or as a thriver. So we need to listen to the anxiety management. There's so many things that we can learn. So let's hear from Professor Kimlin Tam. Dr. Taufik, are we ready now?
Yes, it's going to play as an audio, so we should just hold on to listen.
Okay, thank you. We're here. Can you please increase it? Increase the audio, please. Is it playing now? Because we can't hear anything.
It's playing from my hand, but I can't confirm if you can listen from the other side.
Is it possible to increase the volume? We can't hear anything. I can't hear anything. Let me not speak for others. Please indicate if you can hear.
I can't hear either. It's not
Okay.
audible, Dr. Taufik. It's not audible.
We need to increase it, please, Dr. Taufik.
Mm. It has been very inspiring hearing all these unique journeys these great women and men have gone through. Listening to you in this webinar, it really sparks that survival spirit, that encouragement, that resilience to always move on. There is more to life. We always tell patients, cancer survivors, and their family, relatives, and even their community that this diagnosis does not define you. You need to understand yourself, use your strength, and make things better. There are champions, survivors who are still going to work and providing for their families, helping the community, even helping other sick people. So we should not say that it's a death sentence. Even survivors with metastatic disease these days are staying longer, living longer with the new targeted therapies that we give, with this kind of precision treatment that is being given. So it is really inspiring listening to all these recounts by our cancer survivors, fellow advocates. You have become the voices that we want to hear. We don't want dejected voices. We don't want voices that 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 that, that signal it's the end. We want voices that encourage us to stand
Okay.
and go
How
forward
about,
every
can
day.
we confirm now?
Yeah, beautiful. We can see the screen now. The
You can
topic.
see the screen, but no audio yet.
Yeah, just hold on a bit.
Okay.
All right. Yeah, thank you very much. So
Doc-
it's
Thank
wonderful.
you very much, Dr. Usman, for that addition. You have really spoken well. Honestly, nobody can tell the story like those that have been in the shoes. And it's not some
Yeah.
kind of experience that you really want people to, you want people to go through. You even pray that your enemy shouldn't go through it. Just as Dennis was saying the other time, she was talking about her daughter who will be graduating and that she saw her last when she was in GS1. That reminds me of, the kind of feeling I had too then. At the time that I was going through mine, my son was in SS1 and my daughter was in GS2. Today, both of them are graduates. Time has so flown. I remember how it was. It was about the time he was getting ready to do his Cambridge examination. I remember doing a surgery in between the time that he was having the examination. I remember how things went at that time. It was a there'll be no tomorrow, But today, I'm so glad that things have really changed. Life has become a lot easier for everyone, and even for the
Yeah.
people who are going through it now. Honestly, whenever I go
Yeah.
to loot these days, I always just tell them, I congratulate them before speaking. And they're looking at me as if, what are you congratulating us? Like, yes, if you know what it was like, because I had my treatment here in Nigeria,
Mm.
and I had it in the same Luth. At that time, we had nothing called chemotherapy chairs.
Wow.
Chemotherapy is even one of the least things that you can even think about. We had only
Wow.
one radiotherapy machine working in the whole of Nigeria, apart from the
Hmm.
Cobalt 60 that was working, the one that was owned by a co-hospital. The only one
Mm.
that was working then was the one in Luth, and everybody from all over Nigeria was coming to use that machine. That
Wow.
time, I'm telling you, that machine will break down from time to time. Things happened. But you see, today I don't regret things any longer. Instead, I just give thanks to God. At the time that I was diagnosed, I would always ask God, God, but why me? Because I was just so different from, I didn't think that it could come to me at all. I never fell ill for anything. The only times I had to go to the hospital was when I had to go to have my children, which was
Wow.
several years, 14 years before I was diagnosed was when I had my, sorry, 15 years before I was diagnosed was when I had my first child. And the other one was 12 years before I got diagnosed, you know. So I had a 12 and a 13, let's say 12 and 13-year-old at that time. So you can imagine it was a time when it was so things were really, really difficult. Apart from that, it was a time when each dose, if you were unfortunate, I would say, to be classified under the HER2 positive, and you had to use Acceptine. Acceptine dose was being sold for 1 million naira per one, and you have to
Wow.
use 18 of that. So God help you if you're from a family. In fact, even when you're from a rich family, it was not like it wasn't the kind of thing you wanted to spend money on, because that was just the price of the accepting that you were going to use throughout your time. It wasn't the price of chemotherapy, it wasn't the price of radiotherapy. Life was so difficult that women would come to the hospital, and once they were diagnosed, they would rather go back home, keep quiet, and die rather than be shamed for having a disease they knew nothing about. A
All right.
disease
Is the
is
video
more
ready
than
now? We really
Yes,
resonate with,
yes,
you know,
from
the
Dr. Aisha.
resilience you both.
Dr.
All right.
Aisha is
All right.
trying to share. So let's check. Thank you.
Okay,
All right. All right.
I don't know. Can somebody
You can go on, Dr. Usman, while Dr. Aisha is trying. Let's know it when
Yes.
you're ready, Dr. Aisha.
So this
Okay.
has really shown how things have changed for the better, and we should, as much as possible
you
as a
hear me?
community, continue to encourage each other,
Can you hear
continue
me,
to
please?
encourage. Yes, Ma, we can hear you.
Dr.
Yes, please.
Aisha.
Need to communicate. Can you see my screen, please?
Yes, we can
Yes,
see your screen.
yes.
Can you see the presentation?
It shows the iPhone not found. It shows 3 windows above. Yes,
Okay,
now we can
okay,
see Aisha,
okay.
Mustafa,
So
you. Okay, we can
okay,
see
so
the
let me
screen
just
now.
do it again. But I'll need somebody to be able to confirm because the video started playing, but I couldn't get to confirmation. I'll just try again now. Try to help me confirm if you can see the presentation. And you can you hear or both?
Yes, we can see the screen now. Okay.
Can you see the presentation? Dr.
No, we
Kimlin's,
can just see your
can you?
computer.
You can see
Yes,
the
yes,
presentation.
yes.
You can
Now
see
we
your
can see
screen right
key
now.
strategies.
Okay, so
Yes.
that was what I've been trying to confirm.
Okay.
So I'm starting again now. Please, can you confirm you can see and you can hear?
So we can all mute our microphones now to listen to this
Can you confirm if
wonderful
you can see and
presentation.
hear me, please? Can you confirm if you can see and hear the presentation?
I can't hear.
It's playing but has no audio.
Mm,
Um, I can hear from still can't hear.
It's playing but has no audio.
Oh, sorry about that. I have to stop. I thought I could. And I can but I don't know what.
Aisha, can you use your second device to project the sound? Maybe that can help temporarily.
Or if you have a microphone that you can add to the, can you hear the audio yourself?
I can hear it clearly.
Faintly, right?
I can hear clearly, very loud.
Oh, really? We
Yeah.
can hear. We can hear it. We can hear it.
So since you're logged on with two devices, Aisha, why don't you put let's hear the sound from your device since you're there and you're hearing.
Okay, let me try that.
Shall we try that, sir?
Present you an anxiety cancer. Managing cancer-related anxiety and multifaceted and adaptive approach that prioritizes accessibility and cultural embeddedness. I will now discuss some key strategies, evidence-based strategies to address patients' anxiety and distress. A stepped care model is encouraged. This approach frames resource-intensive interventions. First, education and self-management strategies, and then escalating, increasing to more intensive therapies, such as cognitive behavioral therapy and medication only if needed. Telehealth is a critical component of providing resources and support for cancer patients. Telehealth services can bridge geographic barriers and distance, allowing patients and family members in remote or rural areas to access mental health services. Peer-based important and valuable component of providing psychosocial supportive care. Peer support programs can provide social support and improve psychological outcomes, and especially in a resource-limited setting. Addressing ancient language barriers can facilitate ability and usability of service resources to address anxiety, depression, and distress. Financial assistance programs can help patients with therapy, medication, and other essential support services. Destigmatizing mental health issues, depression and anxiety symptoms are quite a normal part of adjusting to cancer. However, when it becomes escalated and the person is unable to manage or engage in daily activities, then the person is not able to. And this is detrimental to both physical and emotional health and well-being, as well as their recovery from cancer. And the need for health support and spiritual support is. I would like to present some key strategies in providing quality care for cancer survivors and addressing their anxiety. Integrated care. Integrating mental, physical, and spiritual health care ensures comprehensive whole person care for cancer patients, addressing both their physical and mental health and emotional needs. Mental health and emotional well-being awareness. Raising awareness about mental health, emotional well-being, and reducing stigma associated with mental health needs is critical and crucial for encouraging help-seeking behaviors. Training healthcare professionals. Integrating psychosocial oncology into oncology training programs. Equip healthcare professionals with the skills to identify and address patients' emotional needs and distress. Culturally adapted approaches. Tailoring your interventions to specific cultural contexts is essential for maximizing effectiveness, patient responsiveness, and their adherence with your care. Importantly, patient education and training on self-management are two very important components of addressing anxiety and depression. Providing patients with education about cancer-related anxiety and equipping them with self-management strategies such as relaxation techniques, mindfulness, spirituality coping strategies, including prayer and support from their spiritual group, can activate and better prepare patients and survivors and even their family members to cope with anxiety and distress. Access to therapies. Evidence-based therapies such as cognitive behavioral therapy, behavioral activation, and mindfulness-based therapies should be made accessible as much as possible to those who need them. Addressing caregiver needs, another important component, recognizing that cancer impacts not only patients, but also their caregivers, is crucial in providing support for whole person care and whole family care. A very effective self-management strategy involves a healthy lifestyle for the cancer survivor and their family members. Maintain a healthy weight. Engage in regular physical activity and play. Play with your kids, with your family members. Put on some music and dance. All of these are very important to not only physical well-being, but importantly, mental and emotional well-being. Enjoy a balanced plant-based eating, rich in fruits and vegetables and whole grains. A diet that's heavy in animal-based products and meats are not cancer-fighting. Stay adequately hydrated with water. Avoid sugary beverages. Avoid tobacco at all costs, including secondhand exposure. Limit alcohol consumption. For men, if you drink, 2 drinks per day. For women, 1 drink per day. And prioritize sleep and rest. At least 6 to 7 hours per night is recommended for rest and rejuvenation. Trained and equipped to provide psychosocial and supportive care services. Many people, many and diverse persons, including professionals and lay persons. Training in psychosocial oncology advocacy is crucial so that any survivor with depression or anxiety symptoms can receive care. Different sectors can be trained at a variety of levels. Patients with cancer can be trained, caregivers, family members and friends, community health workers and navigators, of course, healthcare providers, including primary care providers and specialty care, including oncologists. Staff in healthcare organizations can be trained, front desk staff, schedulers, social workers and psychologists, as well as faith-based organizations and teams. Community members can be an important part of providing psychosocial and supportive care to cancer patients. And here's a summary of the ASCO guidelines that I was a part of in updating the guidelines for addressing depression and anxiety in cancer patients. So for patients with moderate to severe depression symptoms, culturally informed and linguistically appropriate information should be provided to patients and patient-identified caregivers, family members, and trusted confidants. Information might include the following, including the frequency of depressive symptoms, common psychological, behavioral, and vegetative symptoms, signs of symptom worsening, an indication to contact the medical team with a provision of the contact information so the person or their family members know who to contact. So this is evidence-based, and it's important to provide this education for patients. For patients with moderate symptoms of depression, clinicians should offer individual or group therapy with any one of the following treatment options: cognitive behavioral therapy, behavioral activation, structured physical activity and exercise, mindfulness-based stress reduction, psychosocial intervention, that's relaxation, problem-solving skills. For patients with severe symptoms of depression, clinicians should offer individual therapy with one of the following treatment options: cognitive therapy or cognitive behavioral therapy, behavioral activation, mindfulness, stress reduction, as well as interpersonal therapy. Treating clinicians may offer a pharmacologic regimen for depression in patients without access to first-line treatment, that is behavioral therapy. Those expressing a preference for pharmacotherapy, or for those who have not improved with the first-line psychological or behavioral management, pharmacotherapy should also be considered for patients with a history of treatment response to medication, severe symptoms, and any accompanying psychotic features. The guidelines for addressing anxiety symptoms. For patients with moderate to severe anxiety symptoms, culturally informed and linguistically appropriate information should be provided to patients, family identified caregivers, family members, and trusted confidants. Information might include the following: common or frequency of the distress or anxiety, psychological or behavioral and cognitive symptoms, indication of the symptoms worsening, and provision of the medical team to contact for assistance or services. For a patient with moderate symptoms of anxiety, clinicians should offer individual or group therapy with one of the following treatment options: cognitive behavioral therapy, behavioral activation, structured physical activity and exercise, psychosocial interventions with empirically supported components such as relaxation, problem solving, therapeutic writing, journaling are all very important components and engages the patient in the self-management. For a patient with severe symptoms of anxiety, clinicians should offer individual therapy with one of the following treatment options: cognitive behavioral therapy, behavioral activation, mindfulness-based stress reduction, and interpersonal therapy. Treating clinicians may offer pharmacologic regimen for anxiety in patients without access to first-line treatment, those expressing a preference for pharmacotherapy, and those who did not improve with first-line or behavioral management. Thank you so very much for your time and attention and this opportunity to share on caring for patients, including addressing distress, anxiety, and depression. Thank you and enjoy a wonderful conference.
So thank you. We should say thank you to Professor Kim Lin Tam Ashing. She has practically told us the key strategies which she mentioned as third care model, telehealth, support programs, addressing patient level behaviors, and she actually told us about the summary. She actually summarized the guideline recommendation. So thank you once again to Professor Kim Lin Tam Ashing. Next, we're going to have Dr. Usman. Would you like to do some more contributions before we go on to the Honorable who is giving us the goodwill message? Dr. Asana.
So it has been okay. So it has been a very thoughtful combination to join depression, to join these different discussions with survivors and champions. This is something we see every day in the clinic, and not only in the patients, even in their loved ones. So it's very important that mindfulness, that spirituality, concern, these are all different domains in care. Presently, we all look into the palliative domains of care, which starts from the bio, dealing with the kind of malignancy, its kind of medications, targeted therapies, schedules of treatment, all this we do. Then we look at the physical symptoms. Physical symptoms we manage: nausea, vomiting, bone pains, leg pains, swelling, all these are managed. Then the psychological, very important. That is the supportive care that the individual gets from the family, from the community, from even their healthcare workers, from friends, from the society, and then the spiritual component. This area is not really our domain, but we encourage the individual to get that spiritual care, that spiritual support, that spiritual reinforcement. And anxiety and depression, that psychological management is very important because this is palpable. You can feel it. When you speak with some patients or their relatives, you can feel that anxiety, that fear, that worry. And that is why, as a healthcare provider, you need to be empathetic. You need to speak to your survivor as an individual. He or she is a human being. They are not statistics. They are human beings. You speak with them, you understand the body cues from the patient and the family members. You are now able to understand the challenges they are facing, and then you guide them to be able to have a seamless cancer care journey. So this is a very pivotal topic, very important. Because even for people that have finished treatment, that anxiety, that depression it is there. And these different strategies, coping strategies from Dr. Aisha, Princess Tinu, Dr. Denise, and so many other survivors that we speak with, and champions that we speak with, and thrivers that we speak with. We'll even learn from them. And this helps us to become better healthcare workers, better family members, better friends to our patients and families and relatives that have this condition. So I don't want to say too much. Let's not take too much time, but I really commend the resilience, and I hope to see this ignited in many of our other patients and survivors, so that it even helps our work easy. Collaboration is the key. This is very important. Of course, one person can't even manage cancer. So you have to understand that that multidisciplinary team of specialists, that community is important in management. And so it is for the cancer survivor, from the community, from the family, from friends. Dr. Aisha, she's a strong lady, even from medical school. I know her. But you see, even she admitted that many times she had to affirm that positive affirmation. When you pray, they are all positive affirmations. The meditations we do when we pray, we tell ourselves good things and these good things materialize. Thank you very much. So, Princess Tinu, we can now go ahead to the next stage. Thank you very much. I hope you can hear me. The network has been breaking. Hello. So we can go on to the next. Hello.
Oh, Dr. Asana, so sorry. I was communicating with Dr. Taufik. He was passing a message which I really don't understand. Yeah, so I'm sorry that I
So
had
we
to
can
go.
go. No problem. I thought
We can
I
go
was
on
the one that was logged out.
the
So
special
we
guest.
can go ahead now. Yes. Thank
We
you.
can okay. We can go on to the special guest of honor, Honorable Kunle Olanrewaju Ibrahim, the SSA to the President on National Assembly Matters, who will be giving us a goodwill message. Are you on board, Honorable? I spoke with him the other time, so I think he's here. Honorable Ibrahim.
Hello, good afternoon.
Good afternoon, Honorable, and you're welcome to the webinar.
Good afternoon. Thank you
Good
for
afternoon.
having me.
You're welcome.
Ladies and gentlemen, I welcome you to the webinar. And I bring you greetings from the President of the Federal Republic of Nigeria, President Bola Ahmed Tinubu, GCFR, the leadership of the 10th National Assembly, and the Speaker of the House of Representatives, Right Honorable Tajuddin Abbas, PhD. The theme of the session is Hope Rekindled, to commemorate the National Cancer Survivor 2025 and to celebrate our champion is quite topical, as it's underscored the need to assess where we are as a nation with a view to redefine our focus, particularly providing the necessary legislative frameworks that will assist in enacting globally relevant laws to enhance patients' care, treatment, and support across the 774 local governments in Nigeria. The Renew Hope agenda has a central placement for healthcare and treats the health of Nigerians as an urgent matter of right. In consonance with this, the Health Sector Renewal Investment Initiative, which is a blueprint developed to actualize the vision of Mr. President, is resting on unique 4 pillars. These are improving healthcare governance, improving population healthcare outcomes, with priority on efficient, equitable, and quality health system, unlocking healthcare value chains through the various platforms and strategies, including sector-wide approach, local manufacturing of healthcare commodity, research and innovations, and the health security of Nigerians. The presentation of Professor Kim Lim Tan on anxiety management and physical well-being underscored the importance of adequate and emotional support for cancer patients. In addition, our host and champion, Dr. Dennis, and the CEO of Commod Cancer Foundation Nigeria, and that is presentation on the last after diagnosis, shows that adequate adjustment to a new normal is crucial to living a fulfilled life. I'd like to thank Dr. Aisha Mustafa, our reverse senior lecturer and consultant, and his presentation on the significance of emotional balance in coping with diagnosis and treatment. These were thought out titles and presentations are timely to support the nation's quest to support reducing the cancer burden. On our part as a legislature and working with the relevant stakeholders, we have developed the following in the last few years, to mention but a few. 1, the National Health Act 2014, the National Tobacco Control Act 2015, the National Institute for Cancer Research and Treatment Establishment Act 2017, the National Strategic Cancer Control Plan 2023 to 2027, the National Cancer Control Plan 2008 to 2013, 2018 to 2022, the National Center for Cancer Treatment Bill of 2022, the Mandatory Cancer Education Bill of 2023, the Lagos State Institute for Cancer and Disease Control Law of 2017, the National Agency for Control of Cancer, the Establishment Bill of 2020, Cancer Registry Bill HB 110, state-level adaptations of the NCCP by Ogun, Enugu, and Oyo State. Then the Nigerian government, through the Federal Ministry of Health and Social Welfare, is also exploring a unique approach to cancer care through health insurance coverage for cancers. In accordance with the National Healthcare Insurance Authority Act of 2022, the NHIA has developed a robust concept note and implementation plan for catastrophic health insurance, which shall support patients with end-stage renal diseases, sickle cell disease, and cancers. And then the proposed National Cancer Act, announced by the 10th House of Representatives in 2024. This proposed legislation is a response to the increasing burden of cancer in Nigeria and aim to provide a comprehensive legal and policy framework for cancer control. Among its key components are provisions to expand cancer screening and early detection services, improve access to affordable treatment, promote research, and provide palliative care services. The Act will also establish and strengthen the comprehensive cancer centers nationwide and create a cancer drug fund to subsidize the cost of the advanced therapies. By addressing the systemic barrier to cancer care, such as limited infrastructures, inadequate personnel, and high treatment costs, the National Cancer Act is supposed to become Nigeria's most transformative legislation in oncology care. The proposed law underscores the government's commitment to ensuring that all Nigerians, regardless of socioeconomic status, have access to effective cancer prevention and treatment services. The National Institute for Cancer Research and Treatment has been working hard to provide ease of access to the Cancer Health Fund and expand its scope in terms of types of cancers covered and the health institutions where they can be accessed. It has also proposed a major increase in the volume of funding available while initiating reforms to formalize and harmonize cancer registries across the country to create a unified government operationally digitally enabled platform that enhances data collection, surveillance, and research in line with international standards. The agency is training several cadres of healthcare professionals and working with hospitals to upscale the provision of clinical preventive services for cancers. Distinguished ladies and gentlemen, I want to commend the management of Carry Cancer Healthcare Initiative, KCHI, and partners for organizing this webinar to celebrate our gains and as well impact the right education for the general population. This effort will, among others, helps to lower the disease burden in Nigeria. A healthy nation, they say, is a wealthy nation. More awareness creation and commitment of stakeholders are therefore necessary to ensure adequate mobilization of resources as a government and coupled with the effort of the First Lady, Senator Oluremi Tinubu, and wives of governors of the 36 states. We shall continue to deliver on the promises made to healthcare to make healthcare affordable, accessible, and with all support required for a healthier state and nation. Thank you, and God bless.
Thank you very much, Honorable Kunle Olanrewaju Ibrahim, for that speech, for the beautiful goodwill message. We really appreciate that. Moving on now, we'll be going on to the vote of thanks, which will be, sorry, I'm trying to get out the name of the ED.
Yes, I'm here, Princess Tino.
Okay,
Can
thank
you
you.
hear
I'm
me,
so
ma'am?
sorry. I want to introduce you properly. Just 1 minute, please. Okay, sorry. So we'll be moving on to the vote of thanks, which will be read by the EDKCHI. Am I right to say Dr. Azan Madina?
No, Madina Hassan is better.
Okay, Madinat Azan, thank you for thank you for putting this together, because obviously as the ED, you must have been one of the people that did this. So can we have you give us a vote of thanks, please? Thank you.
Thank you very much, Princess Tinu, for the well coordination. And I just want to thank our distinguished guests. On behalf of the Career Cancer Health Initiative, we extend our sincere appreciation to everyone that has joined us today for the 16th webinar series to celebrate our cancer champions. And despite the technical glitches that we experienced, as well as the network challenges, your patience, understanding, and commitment kept the spirit of the event alive. And for that, we are truly grateful. To our insightful discussants, Professor Kimlin, Dr. Dennis, Dr. Aisha, thank you for a well done presentation. Your contributions have rekindled hope in the hearts of participants today, especially for those that are currently undergoing the treatment. And I know they will resonate with the "Be tired but not give up" slogan. And your presence today is a testament that early detection can translate to survival. So thank you very much for the presentation. And to our special guest of honor, we appreciate his words of reaffirmation towards a shared vision for a better future in cancer care and advocacy. We also extend our heartfelt thanks to Dr. Anatu, Princess Tinu Lawal for their graceful coordination and energy throughout the session. Thank you very much. Thank you very much to everyone today. Continue to inspire action, courage, and healing in all our communities. Thank you very much.
Thank you, Azan Madina. Thank you so much for that beautiful vote of thanks. I was just made to understand that there'll be certificates shared to respective persons who have been a part of this webinar. But before we finally close, I would like to ask if there, from every other person on board, I mean, in this webinar, we will be welcoming questions or discussions, but briefly, please, because we'll have to let everyone go by 1 p.m. So if there are going to be any questions, if you have questions for this webinar, can you please indicate by raising your hands so that we can have you contribute to this webinar? Okay, I can see Akifenwa Malaja. Please, can we have you, please? Please go on. Does anyone need to mute him? Please mute him.
Okay, can I be heard now?
Yes, we can hear you. Please go on. Yes, we can.
Thank
We
you
can
very
hear
much.
you.
I want to really thank Kyra Cancer Health Initiative for bringing up this wonderful platform for us to learn more about thriving from cancer cases. This is my question. 3 years ago, I was with my friend in Lutz. His daughter, 8 years old as of that time, was diagnosed of cancer. And before we could get attention to really assist to manage the girl, it was really rough. So we had to start running here and there. I want to ask. Eventually, we lost her. We went through the first stage, the chemotherapy, and we're about going for the radiotherapy before we lost her. My question here is, what can we do more to actually make cancer patients to get immediate or quick attention? I'm very sure if that girl had been attended to early enough, perhaps she may be one of the survivors that will be, celebrating today. So, do you have any advice in this case? Thank you very much.
Thank you very much, Mr. Akifengba, for that question. Before you're being responded to, let's have the question of of Mr. Ronald Ayodele. Mr. Ronald Ayodele, can you hear me?
Yes, thank you. I can hear you.
Okay, please, can we have you?
Hello, can you hear me? Can you hear me now?
Contribution, please go ahead.
Yeah, we thank God for this type of webinar, and then we thank God for the National Society of Cancer of Nigeria, and then for every initiative that has fought in the recent years. Cancer has been something that when it happens, even before people just die without any diagnosis, it's at the PM table that we just got to know that that person succumbed because of cancer. But the level where we are, the awareness that is operating now has been very, very encouraging. In my own journey,
You're breaking off. We can hear your question. We're breaking off. Can you hear me? Mr. Ronald, your network. Mr. Ronald? Okay, I can also see Mr. Boy David. Mr. Boy David, can you hear me?
Yes, I can. Thank you.
Please, can you ask your questions? We'll come back to Mr. Ronald.
All right, all right. Actually, I do not want to ask a question. I just want to commend the organizers, Kaira's initiative, health initiative, for raising a platform like this to discuss and also to elaborate on ways that could make these things better.
oh no.
Because cancer
Okay.
on its own is an endemic to me. I see it as an endemic, and the more aware people are about the causes, the preventions, and other ways to manage it, would make life much more better for all of us, regardless of which is without the survivors alone. And celebrating the survivors also helps them to know that they are not standing alone. It reduces the stigmatization, it reduces the lack of awareness, which is the ignorancy that translates to many other things that we see in the community today. So, all in all, I just want to say I am glad that there are people like you out here who are doing this good work. God will bless you and promote.
Thank you for that contribution, Mr. Boy David. That's truly a very good one. And I'm sure the Higher Cancer Health Initiative, they appreciate that. They really like that coming from you. Mr. Ronald Ayodele, are you okay with your network right now? Can you speak now? If not, we go on to
I don't
Mr.
know.
Bright. Are you okay now? Can we speak now? We can hear you now. Yes.
Can you hear me?
Yes, we can.
Can you hear me?
Yes, we can.
The network is down. Okay. Yes, I just want to know. I want to know how far the what we call the Cancer Aid Fund. The awareness on it is very, very low. A lot of people couldn't access it. I think a lot of effort needed to be done on what can be available for people who have cancer to be able to access funds. We should intensify effort at in the area of advocacy and awareness that we create. That people should know that they should have that background that they can access funds from the federal government. Some people after that.
Thank you, Mr. Ayodele. Are you done?
Diagnosis, they disappear into thin air. Probably it's time to go and die.
Okay.
Thank you.
Okay.
Yeah.
Thank you, Mr. Ronaldo Ayodele. Your contribution is noted. Can we go on to Mr. Bright Joseph, please?
All right. Thank you and good morning, everyone. I hope
Good
I can
morning.
be.
Yes,
Yeah,
we can hear you clearly. Good morning. Please go ahead.
yeah. I want to appreciate this platform and this webinar. My own is I can additional input. This is a very wonderful opportunity and platform for survivors and those having such challenges. But the awareness, like the other speaker, Mr. Roland said, is limited. This is my first time, and I'm here on this platform through Dr. Hanatu, who has extended partnership in my facility for tele-oncology project. As such wonderful platform, I think apart from personal information like this, it should be more elaborate in other medias where people going through such challenges and have hope, because the presentations were so inciting, so lively, so enlightening. So my input is expanded awareness and advocacy for patients or hospitals. I've been working, I'm not a healthcare provider, but working in a hospital but for almost 2 decades. But I've never known such platform exist until Dr. Anato extended such to us. So please, let there be more extensive awareness and advocacy. Thank you very much.
Thank you very much, Mr. Bright Joseph, for that contribution. And I'm sure the Higher Cancer Health Initiative, they're glad to hear that from you. And we should also say thank you to Dr. Anatu too for inviting you. You have had it, Dr. Anatu, well done, well done. That's good advocacy right there. We still have one more person, Mr. Ejiro Obrihe. Am I right? I don't know if the pronunciation is okay, but Mr. Ejiro, if you can hear me, you have the floor.
Okay, thank you very much. I'm actually Mrs.
No,
Ejiro.
sorry. I'm sorry. How do you pronounce the other name? Obrihe, right?
Obrire.
Okay.
Yeah, thank you very much. I want to say a very big thank you to all those responsible bringing together this everything about this platform. It was really informative. Yeah, my question, because sometimes I've had the opportunity to hear about cancer, especially as related to women. Now, people will say, oh, it's very important for you to know your status early because it's better you know early. Because when you know early, you have a high chance of treatment. So when you get to know early. So my question now is because sometimes people will say, okay, where do I go for this screening? Some people don't know where to go for screening. And even when some people ask, the price for this screening is very high. So my question I need to know the different places where one can go for screening. And secondly, is there a place that one can do this screening for free? Because actually I'm in Delta State and I don't know whether this screening can be done free in Delta State. So I think that's the major question I have now. Thank you very much.
Thank you, Mrs. Obrire Jiro. Thank you for that contribution. From what I can gather from most of this contributions from the platform is that the awareness should be more. Awareness is what we will keep doing. We have to keep doing. There are loads of platforms like this. This goes on every time. That's answering those who have never been to this kind of platform. But like you said, as you have requested, there should be more and more and more of this awareness. In our advocacies, we as advocates should do more of this, because I've just realized that what we've been doing, even though we've been doing it for so long, is still like a drop of water in an ocean. So we should continue with advocacy in every aspect that we all are advocating against cancer. Thank you. Do we have respondents to Dr. Asana Usman? Sorry, Dr. Asana Ayuba Usman. Yes, I'm right.
Sorry, it's Dr. Hannatu Ayuba Usman. Thank you very much for this kind of advocacy platforms are going to continue to raise awareness. We are going to continue to do this in different collaborative platforms. Collaboration is the key. If you notice, this platform is powered by so many partners, and that is where we are aiming at: collaboration. Collaboration is the key. One person can't manage a cancer patient. It has to be a team of different doctors, all bringing their inputs, different specialists, all bringing their inputs, even the family. And even after all these inputs are brought out, the individual, the survivor, has a role to say, has a voice, even in their treatment. That is why we talk about shared decision making. So thank you, Mr. Bright. You're always blowing our trumpet everywhere. Thank you very much. I appreciate all this appreciation you're giving to me, but it's a teamwork, and you are also part of that team that is making giant strides in the Teleoncology Hub. Thank you, sir. So thank you very much, Princess Tinu. You can continue, please. I'm moderating with you. I'm by your side. I'm behind you. I'm all for you today. So let's continue to rekindle
Thank
hope,
you.
support.
I think Dr. Aisha Mustafa is saying she wants to respond to the.
Okay.
Dr. Aisha.
Hello, well done. Good afternoon again, everyone. I just have specific questions that caught my attention, and I think it's imperative that we respond to the specific questions. So somebody talked about healthcare worker attitude. That is very concerning. We are not going to pretend it doesn't exist. That was why I emphasized a lot of empathy when we care for patients. In fact, not just cancer patients, everybody deserves empathy. And they could have maybe reasons why they act that way, but we should know that ethically and in our practice, empathy is embedded. So I think we'll keep talking about it, and hopefully we'll see how we can improve on that. But specifically, I think all of us will have a role in training and retraining ourselves to be able to give that empathy, because we also have personal issues, and some of us just bring our problems to the hospital. And I hear people say, even me, background. Sorry, there's a bug. Yes, that's better. So, we come to the hospital and you hear healthcare providers saying that, I have my personal problems, so I cannot provide that empathy. It shouldn't be so, and I pray that hopefully we'll get better at it. Very importantly is the Cancer Health Fund. I'm able to talk about that because I'm the pioneer and not the current secretary, the gynae aspect of the health fund. Can we please mute the very disturbing? Please, can we mute when we are not speaking?
I can see that the network is getting really bad. It's getting very close. And then we have just like 3 more minutes, and I can see Dennis Edge's hands raised up. So please, can we just quickly allow her to also mention something, say something before we close, because we're still going to take pictures. Can everyone please get ready to take pictures? Let's take a group picture, please. Dennis, you have the floor, please.
Sorry,
Dr.
sorry.
Dennis,
I put in I'm on. So it's only two
okay.
things. The one thing I wanted to correct is the notion that about what cancer is. The last speaker just mentioned about it's a sickness, or I can't put the exact word. Actually, it's just so that she's fully aware. It's a disease that nobody bargains for, nobody understands. And the fact that we're trying to raise funds, sometimes I would say it is better for you to forget about this smoothie or this drink you want and pay 10,000 to get a yearly check. than for us to wait. Because like everybody points out, prevention is better than cure. Just invest, save money year monthly. I've learned it from this platform, from attending groups like this, that when we keep saving 10 naira here, 20 naira here, at the end of the year, you have enough money to go and do a proper check. Have a proper check than to wait and say you're waiting for government. It's not the right thing, but it is the best thing, in our own opinion.
Thank you
very much.
Thank you. So can we all get ready to take pictures, please? Can we take group pictures, please? Everyone, I'm ready if you're ready. Dr. Taufik, I hope you'll be helping us with the snapping.
Excuse me, please. Can you hear me?
Can we all show our face names?
Me, please.
Briefly.
Can you hear me, please?
Yes, we can.
The one that yes, please put your number on the platform. We communicate with you privately.
Okay. So before we go, I can see on the, in the webinar, the list of names of those that have joined us so far. We have Professor Rosemary Ogu. Thank you, Professor. We have Ronald Ayodele Bejide. We have Shitu Lukayas, Sadiq Abibo. We have Wasiu Oluwaremilekun. We have Yemisi Daudu. We have Yeti Machoko. I'm trying to call everybody's name and say thank you to you. Olanrewaju, Kafila Odeshola, Jumoke Oshoja, Ifenyuwa Okeke, Hassana, Azan Madina, Anatu Ayuba, my co-moderator, Ejiro Bire, Dr. Nsima David, Dennis Ejo, Bright Joseph, Boy David, Balogun Tokpe, Akinfenwa Malaja, Aisha Mustafa, Adeyemi, Adekbeju, Adebajo, the Honorable, and everyone who is on this platform. We say a very big thank you to you for this, for joining us in this webinar. We all have learned something, I'm sure. And I'm sure we're going to we're not going to just, after this program, after this webinar, we're going to act on the lessons or the educations we've learned so far. And we'll all we'll all check ourselves regularly as from today. I'm talking to those who have never been impacted. I don't pray cancer on you, but I pray that it will never come your way. So having said that, we all get ready to take a picture. Can we all say cheese? Are we ready, Dr. Taufik?
Yes, it's been taken.
So do we say cheese or we say KCHI or hi?
All of it, everything is okay.
Just smile and say, get ready. Okay. Are we done?
Yeah.
Are we done? Dr. Taufik?
Yes.
Okay. Thank you, everyone. Thank you for being here. Thank you. Have a very good day. Enjoy the rest of your weekend. Bye. Thank you, Dr. Anatu.
Oh, thank you, Princess Tenu. You've made today so wonderful and colorful. Thank you to everyone that has been here. Thank you. Bye. Have a nice weekend.
And you too. Everyone, bye.
All right. Thank you.